Welcome to today's LiveSafe webinar, Managing Travel Risk During the COVID-19 Outbreak. My name is Dan Verton. I'm the Director of Content and Branding at LiveSafe, and I'll be your host and moderator for the next hour. Today's webinar is being recorded, so registrants will be able to watch or rewatch as your schedule permits. Also, everybody who has registered can download a complimentary copy of our recent travel risk management white paper, Destination Risk: How Community Source Risk Data and Safety Communications Can Improve Travel Risk Management. That's available in the handouts pane on your control panel. We hope to make this session interactive and learn a few things from the audience as well. So we'll be asking 3 survey questions throughout our session today. So please participate and help us get a better understanding of your perspectives on the current situation. Then, after our last poll question, we'll be making an announcement about a new free offering available to any business, healthcare, or higher education institution to enhance your battle against COVID-19. So please stay tuned for that. We have an outstanding panel of experts with us today to help us get a better understanding of the facts and the misperceptions surrounding COVID-19, as well as the travel risk management considerations that businesses and educational institutions must take into account as we navigate this rapidly changing situation. Dr. Rashid Chotani is a professor of epidemiology and a subject matter expert in infectious diseases. He is a professor at the University of Nebraska Medical Center and George Washington University College of Professional Studies. Joe Gleason is the Director of Risk Management at AHT Insurance, where he works directly with AHT clients to develop, refine, and maximize the efficiency of their global risk management strategies and systems. Joe is a former NGO, non-governmental organization, Global Security Director, and a current board member of the International NGO Safety and Security Association. So thank you both for being with us today. Dr. Chotani, I would like to start with you. To the extent that it's possible, given such a rapidly changing and uncertain situation, it would be useful for everybody, I think, to get a professional medical view of the current situation. And it would also be very helpful to, if you could separate the facts from the fiction surrounding the COVID-19 outbreak. But before we do that, I want to alert our attendees that Dr. Chotani has been tracking COVID-19 online at the URL shown on your screen. And he's updating this presentation that's available on demand every couple of days as the situation develops. So I encourage everybody to check it out. So with that, Dr. Chotani, let me turn to you. Give us a sense of how COVID-19 compares to other major viruses that we've had experience with.
Thank you for having me, and welcome to all the audience. This is an extremely dynamic, fluid situation that we are dealing with. Not that we've not dealt with something like that, but this particular situation has some uniqueness, and thus the panic. At present, we have about 130,000 cases, and believe me or not, 5 minutes ago, the counter on the websites that I follow said 129,000 cases. So, things are just moving very rapidly. We have about 4,750 deaths across the world. The disease came to the United States, and it became quite hectic for individuals to deal with it. Unfortunately, we were not really prepared for things that we should have been. We currently have about 1,400 cases, and we have about 38 deaths. We have a problem in our logistical system in terms of getting screening. So that is making things worse. And people are looking for facts rather than fiction. In all honesty, if human beings are given the real picture as what the disease is compared to other diseases that we've seen in the past, and what is it that it's going to do, and the kind of devastation it's going to cause, and what are the protective measures that we can take in order to protect ourselves and our families, things would be a little better. And that's what our objective is today, to make sure that everybody understands what is going on and how you can protect yourself. Now, in all honesty, at this particular point, we do not have a vaccine. We do not have an antiviral for it, for this disease, but I can assure you that we will have an antiviral in the next few months. There are a couple drugs that are being tested, and they've shown very good efficacy in studies in China. And these are not new drugs. These are drugs that had been used in the past for other viral infections. In fact, there's another drug that is an anti-inflammatory drug that has been used for arthritis that has shown a tremendous amount of efficacy, not as well as the other ones that I mentioned earlier, but we will have something in the market in the next few months. But we have to wait a few months. So what do we do to keep ourselves protected in the next few months? I think we all as a nation have to unite. We all as individuals have to work with each other to make sure that we are not getting the infection and we are not transmitting the infection. So there's so many myths, right? People are saying that if you put your hands under the dryer, you will kill the virus. No, it's not going to happen. Please do not go and get ultraviolet radiation to kill the virus. That is something that is a definite no-no. The big question that everybody has at airports and in the travel industry is, are these thermometers useful? Do we have to take temperature? And does it tell you if a person has the disease? Well, to be very honest about it, as I told you, a lot of times, people are asymptomatic. If somebody's traveling, they might have traveled, then they might have stayed there for 3 days, and now they are the incubation period is about 14, can be 7 to 14 days. So the virus is growing in their body and they're really not sick, and they don't have a fever. So it's not very useful. Thermal scans can be, effective in identifying the fever, but it has to be taken with a grain of salt. What one can do is in a work setting, if you have individuals who are coming to work, one of the things that could be instituted that by lesson that we learned from China was useful was that you had this constant monitoring of temperature of people who are in a place in a confined environment, and that kind of helped you a little bit, because a lot of people are sick with some sort of a seasonal flu or influenza or some other virus that's out in the air, and they might be coughing a little bit. They might have some nasal drip or whatnot. But checking temperature is useful, but not super useful. Let's put it this way. Please do not put alcohol on your body. It really is not effective. You really don't, the rest of the body, which is covered, essentially is not going to make any difference. The only place that makes a difference are your hands, because the hands are the things that you bring to your mouth, to your nose, to your eyes, through which the infection can get transmitted. You're not going to put your foot to the eye, or your stomach to the eye, or your mouth. So please, those are basic things. It is safe, right now, to be very honest about it. Even Dr. Fauci talked about it, and I had a discussion about it with a lot of folks at CDC. Having packages that are coming from China, are they contaminated? They could have been contaminated, but the virus is not going to survive on that hardboard surface. Yes, we've seen that it has survived on very fine currency bills, right? And we've seen that happen in China. We've seen that happen in South Korea, where they actually burned some of their currency. But on these regular packages, which take X number of days to come over here, the chances of having coronavirus on those boxes is minimal. The chances of it having something inside carrying coronavirus are very, very, very low or negligible. So if you are worried about it, wear some gloves and open those boxes.
I'd like to turn now quickly to our first poll question of the day. If everyone could please take a moment to answer this question, and then we'll move on to the next section. All right, so interesting results. Joe, as you can see, temporarily suspending business and student travel is a major trend here, and we're going to get to a little bit of that in your presentation as well. So let's move on. So we're going to turn now to some specific travel risk management issues surrounding the current COVID-19 outbreak. Joe Gleason, this is clearly a rapidly changing situation in different parts of the country and the world, but maybe we can start out with a look at the risks surrounding travel now and in the immediate future?
Yeah, thanks, Dan, and thanks everybody for joining today. A topic that I think, as we've probably repeated several times, and we'll say again and again, I think rapidly evolving or quickly developing situation is almost an understatement at this point. The pace of change of this is one of the biggest challenges, in fact, and risks in it. You know, from a travel perspective, there are kind of two broad and really three, I guess, categories of risk. The first is the obvious, the health and medical, top of the list there. In some ways, maybe you know, contracting COVID-19, and people have seen a lot about, you know, how you contract that, the mitigation measures, etc. You know, there is very uneven spread of this disease that is developing literally as we speak, with the likelihood really varying. I think in addition to the contracting COVID-19, which is certainly a risk that's out there, I want to make sure, you know, travelers and those managing travel really look at a secondary, but probably certainly no less important risk, which is the limits on medical care around the world, both to treat COVID-19 and because of strains and wear on the system, whether it's because they are treating COVID-19 patients or in some cases preparing to. Medical systems are increasingly limited, and I think that's you know, for both treatment of COVID-19 and all those other travel ailments that you might encounter while traveling around the world. So that piece is huge. And so, you know, if you're ill in a location, accessing care may be really difficult. And importantly, for travelers as well, the normal infrastructures around medical assistance and medical evacuation may be very limited as well. And I can touch on that in a little bit more detail, but because of the nature of COVID-19, but also just the strains on the infrastructure, being able to rely on those normal systems is greatly limited. You know, in addition to that health and medical, I think probably the most likely challenge and risk that's out there is around travel disruptions. And this again is one of those where it's evolving so quickly. The only constant in this is change. You know, few general categories there that, you know, inability to depart a location, or some sort of movement restrictions like we've seen in Italy or South Korea. And in some cases, it may be a hard and fast, you're not going to leave. In others, it may be leaving is incredibly challenging. Another issue travelers are encountering is denial of entry to a country or quarantine upon entry at either a destination, an interchange point, you know, where you're transiting through. And this list again is growing exponentially. Italy is one of the most obvious. There's a growing list of countries now that are outright denying entry to people who have been to Italy in the last 14 days. And that's true of people who've been to China, South Korea, Iran, other countries. There may be some sort of involuntary quarantine upon arrival. Israel, very notably this week, has implemented a 14-day mandatory quarantine for all incoming travelers. And that includes if that's your home destination. That isn't just if you're an international, that's if you're an Israeli returning home. So these are kind of the main categories that are impacting people. Variations on all of these themes are coming up. And again, going back to that guiding notion in all of this, this is evolving quickly. Keeping on top of it is challenging, but essential for organizations that are doing any sort of travel. You know, and the last piece there I have as a challenge is duty of care. And I guess what I really mean as a challenge is meeting your duty of care. And you know, there are lots of definitions of duty of care. I use one that's pretty simple because it's easy for me to remember, which is, you know, in the travel risk management context, meeting duty of care means having reasonable measures in place to address foreseeable risks. And I think the challenge and risk for organizations and individual travelers right now is probably pretty obvious, right? what exactly is a foreseeable risk in a destination, and what are reasonable measures. And I think, again, this goes back to this quickly evolving nature, not only of the illness and its impact and its immediate medical impact, but obviously these travel disruptions and measures taken by authorities.
So, Joe, when we talk about what organizations can do, one of the first things I think you recommend is to establish a method for communicating best practices for reducing exposure, and then evaluating the travel requirements and adapting your organization to that current situation. Maybe you could walk us through that, and then we'll flow right into some of the risk management principles that are at play here.
Yeah, there are a couple pieces here that I think become really essential. And again, all of these are in the context of the specifics are going to evolve, but I think it's incumbent on organizations that are still engaging in some degree of travel, and although actually this is true for their domestic work as well, is really to promote these best practices. All the things we saw in the earlier slides with Dr. Chotani about the hand washing, the don't go to work if you're sick, certainly don't travel if you're sick. From a travel context, the importance around limiting travel for vulnerable populations, the elderly, those with underlying health conditions. And I think a big piece is allowing people to defer travel without any negative consequence. Because I think at this point in time, there are so many risks and challenges that notion that you could be delayed, your departure could be delayed at a location, turning a 2-day business trip into a 2-week business trip. That has a lot of ripple-on effects for people. So being really flexible and allowing people to defer travel and look at, whether it's web-based meetings, other alternatives, or just frankly postponing and moving things down the road. As organizations evaluate travel, and I'm thinking of the poll that many organizations have really, I think even in the last few days, contracted travel substantially, and I think that is going to be a growing approach to this. But I think obviously limiting where there are active community transmissions, that's almost goes without saying these days. Challenge, of course, being keeping up to date on where those are. Likewise, I would say limiting travel to places where there are evolving restrictions on movement. One of the things that I have really focused a lot on is, and again, this may have even evolved in the last 24 hours with the travel ban that was announced last night, is organizations, if they're continuing essential or emergency or critical business travel, it is really, really incumbent on the organization to define what they mean by essential or critical or mission essential travel. Define what they mean by that. What are those criteria? Is there an approval or review process? And being consistent and applying that evenly. And I think we all sort of have sort of a gut sense of what's essential and what's not. I had a client say to me the other day, well, we kind of know when it is and when it isn't. I would really push back and say a more structured approach now is crucial. Doesn't have to be overly bureaucratic, but you don't want people validating that something's essential, or people feel compelled that they have to take a trip because someone else has, relatively subjectively said it's essential. So defining that essential piece, that essential travel and those parameters is crucial. If you are going to have people travel, communicating the risks, both the travel and the medical, as well as how to mitigate, from the hand washing to the ability to keep yourself lower your exposure. Also reviewing systems for managing medical emergencies and even routine medical issues while traveling. I mean, that's a good general travel risk management best practice. Before somebody gets on a plane, make sure they understand what to do if they get sick. Make sure they understand what to do if they get a medical emergency. It is even more crucial now in this current environment, because all the things that have been happening to people traveling are going to continue to happen, right? Accidents, people are going to trip and fall in the tub. People are going to get GI issues. Accessing care and understanding how to engage that system is important. I also think these two pieces, the communicating risk and the reviewing systems for managing medical issues, doing that before people travel is almost a secondary risk assessment review of the essentialness of a trip. And what do I mean by that? So as you walk through communicating the risks and the mitigation measures and kind of having a good, realistic discussion with the traveler, talking about the accessing medical care, there may be a mutual agreement that says, hey, is this travel really worth undertaking? So I think it's good best practice to do in general. I think it also provides a second layer of risk assessment. Lastly, and by no means least important in this, is it is really essential to communicate post-travel guidance. So when somebody comes back from a trip, what are they expected to do? Should they remain at home? Should they report in before they come into the office? Should they be reporting any second, third, and fourth degree interactions with potential exposure to COVID-19? And I have an example that I fear will start to become a little more new normal, where a organization had a traveler. They were departing a African capital. They loaded on the airplane, and before they pushed off from the gate, there was an announcement that they were removing 4 passengers who had failed a screening for COVID-19. So from various parts of the plane, 4 people get off and leave. This business traveler for this organization continued his journey, flew through Europe, got back home over the weekend. Monday came back into the office, sort of business as usual. He wasn't sitting near any of those passengers who had gotten off. He sort of felt like there was no major issue. By afternoon, when this story kind of wound its way through the grapevine, the HR team said, hold on, you may have had exposure to someone who may have been positive. You need to go home. And ultimately, out of abundance of caution, this person is gonna stay home for 14 days. That person had no guidance. They weren't sure what to do. They didn't feel they met any of the kind of CDC or WHO guidance for direct immediate exposure. But at the same time, there was sort of these multiple degrees of exposure. And I think that is going to start occurring more and more. So post-travel guidance and guidance around how travelers and staff more broadly, frankly, are supposed to respond to that kind of exposure is going to be really, really crucial.
So Joe, before we get to the next slide about risk management principles, I think we have Dr. Chotani back on the line. Yes, thank you. So to Joe's point, we do have 11% of the organizations that are tuning in today saying that they're still going to travel anywhere that they're allowed to travel. And I want to ask you about just how this virus transmits itself and what the dangers are in terms of social distancing and not taking those types of things into account. So if we still have people traveling for business and for other reasons, how important is it that they ensure that they're taking those types of precautions, social distancing and washing, because this does seem to be like a very highly transmissible virus?
Yes, it is. So all non-essential travel should be delayed. If you have to travel and there's no way that you can get out of it, if there's no way that you can do online or meetings and conferences, you have to travel. What you've got to do is you've got to be extremely vigilant in terms of how you're going to protect yourself, because there are so many people at the airport or the train station or the bus station, and you come in contact with so many people that the safe distance is about 6.5 feet away from an individual, where you are not going to be affected by the particles that person might emit when they're coughing or sneezing that you cannot even see. One thing which is good with this virus is that the molecule is pretty heavy, so it really doesn't float in the air for too long. It dissipates or falls to the ground. But you have to consider that when it falls to the ground, it might be a table, it might be a glass surface, it might be a doorknob, it might be an elevator button, it might be the pole that you're holding while you're in the bus or the train, or while you're being transported from point A to point B at an airport. So the chances of you getting the disease while traveling, of course, it used to be that you don't have to travel to high risk areas. I honestly believe at this particular point, anybody who's traveling anywhere is at a risk, period. Because the disease is all over the world. It is in over 150 countries right now. So people who are traveling, who are not really taking precautions, might be giving it to others. It is all over United States. The more testing we do, the more positives we'll get. So a non-essential travel should not be, should one should consider not to do it. But if it's an emergency, if something has to be done, you got to do it. So be very cautious. Carry Curel or some. I'm not going to say Curel. Let's carry something which has 60%, a hand rub which has 60% alcohol in it, alcohol base. Because the virus itself has a very fine envelope, okay, almost not really an envelope, because a lot of viruses have very thick envelopes and the alcohol will not kill them. So the virus, consider the virus as a round ball, and there are these flowers that are coming out of it. Those are the proteins, and the alcohol, what it does, it kills the protein, thus it kills the virus. So that is one of the ways to do it. Is wearing a mask going to help you while you travel? It's a personal choice. I honestly don't think it will, but it's a personal choice. If you feel comfortable, wear it. And just wash your hands and be extremely vigilant in terms of your hygiene. Do not go, if you're traveling, just attend the meetings that you're supposed to attend. Do not put yourself at an extra risk by attending a large gathering or going to restaurants and things like that. Social distances absolutely have a very important role, we're seeing, and I'm sure all of you have seen the pictures of people in Italy going out to get coffee in the morning and staying at a distance from each other. You've seen pictures or videos of people in China when they're going to get groceries, and the PA announces that, keep the distance. So safe distance obviously is something that we have to look at. I was talking to somebody yesterday, and they were saying, how are we going to deal with this thing? This is a catastrophe. I said, well, yes, 9/11 was a catastrophe. TSA, when they instituted all these regulations, was a nightmare. Guess what? Nobody talks about it anymore. Everybody just does it. So it's a habit. We have to change our behavior, and as human beings, we are very good at changing behavior. So we will accommodate, because in all honesty, all of us want to survive and not die. So we will accommodate. We will change our behavior, and in all honesty, to some extent, it's a good thing, because we are going to be much better in our personal hygiene, and taking care of ourselves.
And just to clarify, so if you are traveling, these are the 11% of the folks who said that they are going to continue to do business travel anywhere in the world that they're allowed to, you can contract the virus and spread the virus without being symptomatic, correct?
Agree, absolutely. As I said, 50% of the people who get the virus have no symptoms at all. 80% of the people who get the virus will never have to go to a doctor to get themselves checked, because they have, the rest of the 30% will have some mild symptoms like flu symptoms, and they'll go, okay, I'll take some, I'll drink some Robitussin or take some NyQuil and I'll be okay. So yes, you can be a carrier for a pretty decent amount of time, about 10 to 14 days, and you would not even know that you have the disease. So you can be spreading disease. So the critical thing is to understand that you do not want to get the disease, but you also do not want to spread the disease.
So it's really important that that businesses, organizations understand the role of self-quarantining on the return from business travel to ensure that you're not bringing the virus into your organization.
So yes, absolutely. If you have to travel, you've traveled. Now you're back. You have no fever. You have no cough, but you probably a good probability that you might have contracted the virus. So you're giving it to anybody that's coming close to you at the airport. You're giving it to the driver that's driving you home. You're bringing it home. Then you're going to the workspace, and you're potentially giving it to the workspace. So what are the CDC guidelines for that particular scenario? I don't think there are any guidelines, but there are recommendations that at least if you're traveling and you're traveling to a high risk area, which now the entire world is because it's been called a pandemic, you got to self quarantine yourself for 14 days. So right. Do you really want to do that, or just avoid the travel and do web meetings or web? That's a question that's an individual question, an individual risk that individuals have to take themselves.
Yeah, and hey, it's Joe. If I can just jump in, I think that is important to kind of factor in to Dr. Chotani's point. And is this travel really essential, right? I mean, I think all of these factors kind of add up to cumulatively say, should we really be undertaking this right now?
Yep. Joe, let's transition right into the risk management principles that are at stake here and in play. Talk us through this slide and how it relates to what we just heard from Dr. Chotani.
Yeah, and I'm making a little bit of an assumption here that many of the people on this joining this webinar have some role in helping manage their organizational response, either from a travel or general organizational perspective to this COVID-19 outbreak. And I've, as we've talked in various communities, the risk management community, how should we be kind of promoting the risk management systems and our kind of top level concepts to guide decision making around this? And one is around promoting and modeling best practices and procedures, and those are evolving, and I think it's important to keep up to date on those. I'm going to particularly emphasize the modeling piece, because as leaders, obviously people sort of see what we do, not just what we say. And so making sure we're not only saying do these things, but that we're doing them as individuals, but as management teams and as organizations. I had actually a friend say to me the other day that their organization had moved to essential travel only, and almost immediately in this leadership team meeting, their president or CEO said, "Well, that's great, but I'm not letting this issue stop my travel." Well, that sends quite a signal, right? So as leaders, we should be both promoting and modeling these best practices. Another thing I think that is really incumbent on all of us is reinforcing reliable sources. Look, I don't need to tell anybody here, there's just a myriad of information out there, some of it of whole varying degrees of reliability. But focusing on reliable information that's timely, that's updated, the Centers for Disease Control, the WHO, various assistance companies, International SOS, Helix International, United Healthcare Global, a whole host of those, verified, trusted resources. You can get information overload otherwise. And then lastly, I think as you should for any risk, really thinking through your approaches and your measures and saying, are these really risk-based? Are these measures that I'm undertaking, do they relate to the specific risks? And to me, the easiest way to sort of test each of your measures is to say, why are we doing that? Why are we restricting travel? Why are we having people do these things? Many times it's obvious, right? The mitigation measures, our personal hygiene, is to reduce that transmission and exposure. But the why or the how does it help is important. One, to reinforce with our staff, our travelers, people under our care, custody, and control what we're doing. But I think it also kind of helps reinforce this notion that these aren't arbitrary measures. There is a reason and a rationale, and we should be able to understand and articulate those.
Thanks, Joe. Let's transition now to our second poll question, if we could. I'm going to give everyone 30 seconds to answer so we don't take up too much more time. Shifting gears to our final section, I want to briefly explain how some of the new technological approaches to travel risk management are improving the ability of businesses and universities to collect and analyze actionable risk intelligence in support of their travelers, and also, their ability to communicate timely safety and security information to keep those travelers out of harm's way. Keeping your employees and your students out of harm's way while they're traveling is not just the right thing to do, but it can be very important from a financial perspective as well, and as well as ensuring that you are meeting your duty of care obligations, as Joe mentioned earlier. Travel risks that become safety and security emergencies can be incredibly costly. And, in the worst case scenario, if an air ambulance is required or someone needs to be medically evacuated back to the US or even another location globally because they're traveling in a place where the healthcare facilities aren't adequate, organizations could be looking at a medical evacuation bill in the range of anywhere from $150,000 to $200,000 plus additional costs for medical care. So ineffective travel risk management can result in claims against an organization. In fact, lawsuits alleging failure to meet duty of care can be very financially devastating. In 2017, for example, the Connecticut Supreme Court upheld a $41.5 million verdict in favor of a high school student who contracted tick-borne encephalitis during a school-based trip to China. So keep that in mind. At LiveSafe, we've developed new technology-based approaches to travel risk intelligence and communications that are really changing the travel risk management equation beyond incident response to actionable insights that can prevent travelers from being caught in dangerous or emergency situations. And over time, this data-driven analytics approach on crowdsourced travel risk data can help organizations better understand their actual enterprise travel risks and become more proactive in the development and management of policies, procedures, and pre-trip planning. When equipped with the right risk reporting and two-way safety communications platforms, your business travelers become a more valuable source of information about travel risk and can inform the development of more timely and insightful risk intelligence to guide your actual travel risk management program. Traditionally, travel risk management programs have focused heavily on reaction and incident response. While being able to respond quickly to an incident is absolutely necessary, prevention technologies and strategies provide a far greater return on your travel risk management investment. The goal here, folks, is to get ahead of emerging risks and to be able to act in more timely fashion and prevent things from happening to your people. I think a few brief examples of how we've actually been able to support real-time travel risk programs would be very, very valuable here for folks to actually visualize what I'm talking about. In the first example you see here, we protected business executives and employees who traveled to the 2016 Olympic Games in Rio. We were able to preload safety map information about nearby police stations and hospitals. We plotted dangerous no-go zones that were grayed out on their safety map due to security concerns. And LiveSafe's Safe Walk feature provided travelers with a virtual escort by their corporate security officials or their friends and family as they moved from point to point. The platform also provided users with immediate access to safety and security protocols like evacuation plans, and all of this was preloaded onto their phones for emergency situations. Again, in 2016, LiveSafe partnered with the WNBA to provide security for more than 60 players who were competing in Russia, Turkey, and China, and other various countries around the world. Within a week of the rollout to the WNBA players, a deadly shooting occurred on New Year's Eve at an Istanbul nightclub in Turkey, where several WNBA players were celebrating. The LiveSafe app enabled them to get in touch with the league security office quickly as events were unfolding, and league security personnel used LiveSafe's geofencing technology to send targeted broadcast check-in messages to find out who was in the immediate area and if they were okay or in need of assistance. So this was a very increased rapid operation tempo that was enabled by this type of technology. The league also sent a message to players who were not in the immediate vicinity to warn them to take shelter and to avoid the area of the shooting. So the WNBA is accounting for their people, a process that otherwise may have taken hours or days was accomplished in just a few minutes. In 2017, Brookfield Properties in Washington, D.C. found themselves in the middle of spontaneous protests and social unrest and rioting during the presidential inauguration that year. Brookfield's employees were able to report emerging safety and security incidents and direct resources where they were needed as the protests and riots moved across the city. Now, you can imagine this same scenario playing out anywhere in the world where you might have personnel on a business or school trip. The volume and the pace of the reports enabled Brookfield managers to take proactive measures ahead of the protest movements that ultimately prevented property damages to the tune of hundreds of thousands of dollars. But from a travel risk perspective, a Brookfield supervisor got caught in the middle of one of these violent protests. He was able to request a Live Safe safe walk, and Brookfield security officials were able to leverage that geo-fencing capability to direct police to his location and escort him to safety. So those are really three great examples in my mind of how the technology is really changing the formula when it comes to travel risk management. So that's a real short, brief look at how real-time visibility and safety communications technologies can fundamentally change and improve your ability to keep your travelers safe and informed. There's a lot more information about this in the white paper that we're offering everyone here to download, Destination Risk, and that is being made available to all of you in the control panel. So please check that out. Now, final poll question of the day. Please take So let me turn now to a new free offer that we're making available through our Contingency Planning and Readiness Center, which is part of our corporate social responsibility program. LiveSafe is offering a free limited version of its industry-leading safety and communications platform to any business, university, or healthcare institution that needs a more effective means of communicating relevant information to their community during the current coronavirus COVID-19 outbreak. The platform will enable members of your workforce or your student body to engage in two-way communications with your COVID-19 coordination or response team, and they'll be able to do that anonymously in case there's any uneasiness about talking about this particular issue. You can learn more about the features and capabilities we're making available for COVID-19 response support at our website. Go to livesafemobile.com/contingency. From that page, you can click a button and place your order, and all of the terms and conditions are right there for you. So I encourage you all to take advantage of this offer. We feel it's really important that that we give back to the community, and we truly believe that we are stronger together and stronger as a community when it comes to safety, security, and health. So, Joe, I want to go back to you in the few minutes we have left because we are getting some questions. One of the questions that one of our attendees has is, does OSHA consider COVID-19 a reportable illness?
That is a good question that I don't have an answer to. Dr. Chaitani, you may actually know that. I think the challenge often becomes, was it acquired occupationally? And that's not so much from an OSHA perspective, but I know.
Yeah. So reportable diseases, right? So there are reportable diseases that are on the list, and coronavirus is a reportable disease. Now that came about, that law was put into effect when we had the SARS virus, and then we had MERS. So coronaviruses are a reportable disease. So influenza, by the way, is not a reportable disease, but coronaviruses and other viruses that are that can cause devastation are reportable diseases. So who are going to report those diseases? Physicians are going to report it. Hospitals are going to report it. I don't think OSHA will work. I mean, it is a reportable disease, so it will be reported one way or the other to the authorities, to the healthcare institutions of a jurisdiction.
Right. Another question we got is, excuse me, related to the 14-day self-quarantining. Would it cover employees who were on vacation and flew back, and even if that travel was from one state to the next?
Yeah, so this personal travel piece comes up. I mean, the short answer is travel, right? If you travel and to Dr. Chotani's point, most of the world now is a high risk environment. That doesn't matter whether it was work or vacation. So I think the 14-day self quarantine or isolation applies. Whether it applies domestically or not, I think is beginning to evolve. I think we're learning now about well, we're scratching the surface probably on the degree to which there is community spread in the U.S. And so I would say certainly consider that domestically. And Dr. Chotani, you may have a stronger view on that.
So my personal view is that if you have traveled and if you have symptoms, you definitely have to quarantine yourself. Now,
yeah, certainly with symptoms.
Yeah, exactly. But the problem over here is, and if you are certain that you have communicated or contacted somebody who was tested positive, you need to quarantine yourself. Now, you know that a couple of our legislators quarantined themselves, correct? Because they suspected it or they had the disease. So again, we are scratching the surface of this problem right now. We are at the tip of the iceberg. As things evolve, things will change over time. I mean, which is going to affect everybody and everybody's life and everybody's livelihood in a pretty adverse way, unfortunately.
Right. We had some requests that we repost, Doctor, your website URL.
Please do.
If you want to mention anything else about it.
So yes, so in 2003, when the SARS outbreak happened, I came up with this concept that we will have just-in-time lectures. I wrote a paper in Lancet, and I made a promise that as soon as something like this happens, I will put something out which actually describes the truth and the misconceptions about a disease, so that people could understand it and try to protect themselves, so they would not be panicked. And I've been doing this for coronavirus, the novel coronavirus, COVID-19. I have the 6th version up. It can be translated into 70 plus languages through Google Translator. We've also had individuals translate them, and it's available. It's actually downloadable. So what you can do, and I'll be reposting it in a day or so. So all the numbers are going to change, but the basic content is going to remain the same, and new information is going to come up over there. You can actually download the PowerPoint slide. And in all honesty, I really don't care if you take my name out of there and use some of the slides and educate people so that they know what's going on. And that is the main purpose of this exercise.
Thank you. That's great information. Joe, in our last few minutes, I'll let you share. I know you have some resources as well.
Yeah, and perhaps we can send that around to folks as well. But AHT has assembled a Corona-specific site. We've done a few pieces ourselves, but really what we've tried to do is collect some good, reliable resources that are out there, links to the CDC, for international travel and operations. The Overseas Security Advisory Council has a very good page and list of resources. So what we've tried to do is just kind of collate or gather a group of those key resources, and we update that and pull those in frequently. Because again, I think one of those key challenges we're all facing is sifting through all the chatter that's out there and trying to keep good, reliable, timely, up-to-date information. And so we're trying to do what we can to promote that.
Great. Well, thank you both to our panelists, Joe Gleason from AHT Insurance and Dr. Rashid Chotani. And thank you to everybody who tuned in today. Have a great rest of your day. Stay safe, secure, and healthy. And please, here is my contact information. Reach out to me with any questions or requests for additional information. Thanks all.
Thank you.
Thank you. And do wash your hands.
Yes, good advice.